This program is brought to you by Hometown Veterinary Partners. Learn how you can get on the pathway to partnership at hometownvetpartners.com/vetcandy.
Hey y'all, it's Dr. Deja. I'm a vet with Hometown Veterinary Partners. We're so excited to collaborate with Vet Candy on this project. Want to know more about Hometown Veterinary Partners and how you can get on the path to partnership? Visit hometownvetpartners.com/vetcandy. Best of luck on your tests. Here's Dr. Shannon Gregoire for tonight's quiz night.
Hey there, I'm Dr. Shannon Gregoire, and this is Quiz Time with Vet Candy. Let's get started. Question 1. A 7-year-old golden retriever is brought in for respiratory distress. Pulse oximetry shows an oxygen saturation of 90%. What is the corresponding partial pressure of oxygen, or PaO2, and what does this indicate about the dog's respiratory status? Is it A, PaO2 of 80 millimeter mercury, normal oxygen exchange, or B, PaO2 of 60 millimeters mercury, early hypoxemia, C, PaO2 of 30 millimeter mercury, severe hypoxemia, D, PaO2 of 50 millimeter mercury, critical hypoxemia, or E, PaO2 of 100 millimeter mercury, hyperoxemia. Take a moment now to think about what answer you'd like to choose and drop it in the chat box below. Answer B of 60 millimeter mercury PaO2 is early hypoxemia, with an oxygen saturation of 90% corresponds to a PaO2 of approximately 60 millimeter mercury, indicating early hypoxemia. Choice A, PaO2 of 80 millimeter mercury with normal oxygen exchange, is incorrect, as this PaO2 would correspond to an oxygen saturation of about 95%, not 90%. Choice C, a PaO2 of 30 millimeter mercury with severe hypoxemia, is incorrect, as this corresponds to an oxygen saturation of about 50%, which is much lower than the presented value. Answer D, PaO2 of 50 millimeter mercury, critical hypoxemia, is also incorrect, as critical hypoxemia is more severe and corresponds to lower oxygen saturation levels around 85%. Or answer E, PaO2 of 100 millimeter mercury, hyperoxemia, is incorrect, because this PaO2 would correspond to an oxygen saturation of nearly 100%, indicating excellent oxygenation, not distress. Now it's time for question number 2. A 4-year-old thoroughbred horse presents with a history of prolonged recumbency and now shows signs of respiratory distress. Which condition is most likely, and what is the pathophysiology behind it? Is it A, pneumothorax, accumulation of air in the pleural space, B, aspiration pneumonia, inhalation of foreign material, C, atelectasis, collapse of alveoli due to prolonged recumbency, D, neurogenic pulmonary edema, fluid accumulation due to head trauma, or E, smoke inhalation, inhalation of toxic fumes. Take a moment now to think about what answer you'd like to choose and put it in the chat box below. The correct answer is C, atelectasis, collapse of alveoli due to prolonged recumbency. Collapse of alveoli due to prolonged recumbency can lead to decreased pulmonary ventilation and subsequent alveolar collapse, or atelectasis. Answer A, pneumothorax, accumulation of air in the pleural space, is incorrect, because pneumothorax is typically caused by trauma or lung injury, not recumbency. Answer B, aspiration pneumonia, inhalation of foreign material is also incorrect. Aspiration pneumonia results from inhaling foreign material, not prolonged recumbency. Answer D, neurogenic pulmonary edema, fluid accumulation due to head trauma, is incorrect. This condition is caused by head trauma or seizures, not recumbency. And lastly, choice E, smoke inhalation, inhalation of toxic fumes, is incorrect. This is related to inhaling smoke from fires, not prolonged recumbency. All right, now it's time for question number 3. A 6-month-old calf presents with signs of metabolic acidosis, including sunken eyes and non-responsiveness. What is the most likely cause and what is the appropriate treatment? Is it A, saliva loss and IV fluids with bicarbonate? Answer B, sweating, IV fluids with bicarbonate. Is it C, hypoventilation, IV fluids with bicarbonate? Answer D, hypoventilation, oxygen therapy. Or E, sepsis and antibiotics. Take a moment now to think about what answer you'd like to choose and put it in the chat box below. The correct answer is A, saliva loss and IV fluids with bicarbonate. Saliva in cattle is rich in bicarbonate, and loss of saliva can lead to metabolic acidosis. Treatment includes IV fluids with bicarbonate. Answer B, sweating and IV fluids with bicarbonate, was incorrect. Sweating in horses can cause metabolic alkalosis due to loss of chloride and potassium, not acidosis. Answer C, hypoventilation, IV fluids with bicarbonate, is also incorrect. Hypoventilation causes respiratory acidosis, not metabolic acidosis. Answer D, hypoventilation, oxygen therapy, is also incorrect. This is appropriate for treating hypoxemia due to hypoventilation, not metabolic acidosis. And lastly, answer E, sepsis, antibiotics. While sepsis can cause acidosis, the primary issue in this case is metabolic acidosis due to saliva loss. And now it's time for question number 4. A 3-year-old Pomeranian is presented with a high-pitched sound heard during inspiration. What is the likely diagnosis and the anatomical source of the sound? Is it A, stridor and nasal passages? Is it B, stridor and larynx? C, crackles and alveoli? D, wheezes and bronchi? Or E, rhonchi and trachea? Take a minute to think about what answer you'd like to choose and drop it in the chat box below. The correct answer is B, stridor and larynx. Stridor is a high-pitched sound typically originating from the larynx and is heard during inspiration. Answer A, stridor and nasal passages, is incorrect. Stridor is a gurgling noise from the nasal passages, not high-pitched. Answer C, crackles and alveoli, is also incorrect. Crackles are fine popping sounds from the alveoli, typically heard on inspiration. D, wheezes and bronchi, is also incorrect. Wheezes are high-pitched sounds from the bronchi, often heard during expiration. And lastly, E, rhonchi and trachea. Rhonchi are low-pitched sounds, typically from larger airways like the trachea. And now it's question number 5. A 2-year-old Labrador Retriever is brought in after being hit by a car. The dog shows signs of respiratory distress, including dyspnea and tachypnea. Auscultation reveals no sounds dorsally. What is the most likely diagnosis and initial treatment? Is it A, pneumothorax and thoracocentesis, B, pulmonary edema and furosemide, C, aspiration pneumonia and antibiotics, D, atelectasis and physiotherapy, or E, bronchitis and bronchodilators? Take a moment now to think about what answer you'd like to choose and put it in the chat box below. The correct answer is A, pneumothorax and thoracocentesis. The absence of dorsal lung sounds suggests free air in the pleural space, or pneumothorax. Thoracocentesis is the appropriate initial treatment to remove the air. Answer B, pulmonary edema and furosemide, is incorrect. Pulmonary edema would present with crackles and moist lung sounds, not absent sounds dorsally. Choice C, aspiration pneumonia and antibiotics, is also incorrect. Aspiration pneumonia typically shows harsh lung sounds and crackles, not absent sounds dorsally. Choice D, atelectasis and physiotherapy, was also incorrect. Atelectasis involves alveolar collapse, but typically presents with decreased breath sounds overall, not specifically dorsal absence. And lastly, choice E, bronchitis and bronchodilators, was incorrect. Bronchitis presents with wheezing or rhonchi, not absent dorsal sounds. Well, that's a wrap for tonight's quiz time. You guys did great. Thank you so much for joining us, and we'll catch you next week. Keep studying hard.